My name's Simon Hardcastle, and I'm currently working in Bedfordshire, Luton, and Milton Keynes as their Associate Director of Children and Maternity Commissioning. However, for the last year, I worked in Leicester, Leicestershire, and Rutland as the interim head of children's specialist services, which included children's mental health. So I was responsible for the commissioning of children's mental health services and the work around the Future in Mind programme that had been long-standing for the last 4 years across Leicester, Leicestershire, and Rutland. And so that was my role within across LLR. And prior to that, previously, 5 years ago, when Future in Mind was first launched, I was the regional lead for children's mental health with NHS England, and that was my job. So actually getting the CCGs, getting us, the system leads and system partners, to start developing the Future in Mind plans, transformation plans across the East Midlands. So it's been great to actually see it from the beginning and now to see it all coming towards the end.
For those people listening, Future in Mind was a national programme, kind of with the focus of reviewing the support that children and young people receive, not only the support, but how they navigate themselves through the system throughout the whole of their journey. So it was a real exciting, ambitious kind of national programme. So from your point of view, what did that really mean on the ground for Leicestershire and Rutland's CCGs?
I think obviously it enabled and gave the momentum to focus around children's mental health. So like you mentioned, it was a national programme. The government had invested lots of money into children's mental health services. And this actually brought not just health partners, not just the health leads. It brought our local authority partners together. It brought education. It brought primary care services all together to start looking at, as partners, as a system, how they could improve the services for children and young people across Leicester, Leicestershire, and Rutland. And alongside that, there were some specific targets, obviously, which the national programme set on it, and that was around improving access for children and young people. So that actually meant, how can children and young people better access children's mental health and emotional wellbeing services? So this, again, wasn't just about specialist services. So this was about the services that are available on a day-to-day basis, where children and young people are going. It mentioned about eating disorders, so around having actual access to services in a timely manner. So it gave that momentum to start looking at and addressing some of those elements of what was being provided, and also it gave people the chance to look at actually children's mental health services being provided through education, through schools, through the local authority, through youth groups, through places where children and people would go like I said, on a day-to-day basis, and not focusing just on that specialist element.
But from your point of view, how crucial are those partnerships and collaborations? How crucial was getting them right at the start of the project?
It was really important, because and it's in the title, so a transformation plan. Actually, this was about improving. This was about service redesign. It was around kind of looking at doing things slightly differently than to how they'd always been done. And as part of that, that's why you need those partners involved, because if you're redesigning a service which actually isn't fit for purpose, or isn't going to, or isn't needed, or isn't going to meet the needs of the people that are using it, then there's no point in doing that. So actually having the people who are providing services for children and young people, but also children and young people and families themselves around the table to actually share their experiences, and then using those experiences kind of redesigning the services which are for the future. So actually, which are fit for purpose, which actually are needs led, rather than someone like us in the commissioning teams just saying, "Oh yeah, I think we need a service in schools. Let's just give some money in there." Actually, it wouldn't work like that. So it's really important that the partners are around that table and as part of those discussions.
Do you feel that it has been a huge success, and what has been one of the fundamental things that you will take away from that journey?
I think obviously you mentioned talked about the pandemic and having a massive impact, and one of the ways that the pandemic has impacted us as professionals or as providers of services is that actually it has enabled us to do things very differently. So look at how we're communicating today via Zoom or via Teams, and actually it's added an extra layer of where actually we can reach out to patients, to children, young people, to families, to service users. So it's actually improved, I think, the way, and actually enabled us to actually engage more with the people that we're working with, whether that's our professional colleagues, whether that's the children and people through virtual appointments, through and families through those consultations, like video consultations. It's enabled us to really to do some of the stuff I think we've been talking about over the years, and actually digital strategies are now developing left, right, and centre in terms of of the services that have been provided, because actually they recognise that actually it's an important way. But again, it's without the pandemic pushing us into that, I doubt we would have ever done that in the way and the timely way that we have actually managed to do it. I think when we talk about transformation as well, actually it's about important to recognise that transformation doesn't always work as well. So it's about having the time to try some of these new initiatives and some of these new ways, and actually admit if it's not working well, then we rethink about it. But again, it's like you said, it's about hearing from the people to ensure that they've got that voice to be able to share and express that if it's not working, then these are the reasons why, and we should be listening to that. And I think over the years, and that's why we recognise the importance of all of the children and young people's engagement groups that are we've got across not just in health but the local authority. So the Big Mouth Forum, we've got the Youth Advisory Board, and that was why I felt it was really important to add some investment into those groups and to enable the children and young people's engagement kind of approach to be embedded across LLR. Hopefully, that's been one of the last things I've been able to do as an invest in that, because actually it's needed, because actually it shouldn't be a tick box. It shouldn't be about, oh, we'll ask people when we want to. It's about that constant engagement. It's about that ongoing approach, and then that's where you can then get that true co-production, because actually it's not secondhand in terms of asking. It happens all the time. It's natural then, so it's enabled us to do lots of things very differently, but it's also given a much bigger voice, I think, for young people and the families and patients and service users, because we can access them a lot better. We're not just asking them to come to an old church hall on a Friday evening, kind of, to actually we can get them now anytime. So it's and our shift and our focus has moved as well from just children's, that kind of cultural thing around just everybody needs a CAMS referral, actually, to thinking, well, we've got services now at kind of in the voluntary sector. We've got our early intervention services. There's the mental health in schools program, which actually are enabling people to access support, and it's not necessarily specialist. It is about, if someone answering the question, if someone as a professional came to you and said, "Oh, I feel really sad," how would you then, as a professional, or it's about giving that professional the tools, the information about being able to signpost for young people to get that information without anyone then thinking, "Oh, I need to refer them to CAMS," because it's natural for people to feel sad. It's natural for people to go through a range of different emotions, and we see it now, the pressure on children, young people to perform a lot more in kind of from an educational point of view. In terms, obviously, we've had the recent uh, A-level results, and next week it's the GCSE results coming through. And actually, schools are best placed to be able to support these children and people at that level straight away, because, and again, they've been working with them day in, day out for 5 years, so it's they know the children and people, whereas specialist services such as CAMS may don't know these people. So actually, why are we putting that young person into an environment and having to tell their story when actually they've got the people in schools, for example, who should be able to be offering that lower level intervention, we call it, so that lower level kind of early support before anything escalates. The thing is, but I mean, I worked in as a participation lead for Leicestershire Partnership Trust back in 2005, I think it was 2005 and six,
Yeah.
when there was only three of us nationally working as participation coordinators or workers, and the concept of actually engaging with young people and hearing their voice was alien to so many professionals, because actually within children's mental health services it was still felt that children weren't well enough to have a voice. When you look at all of the work and how it's progressed now to actually, people recognize it's crucial that young people have that opportunity to have a voice. How can you have a therapeutic relationship with someone when you're not asking them whether it's working or not? And it's as simple as some things that, and that's the same concept when we're talking about system and service transformation. We ask them, is it working? Does it work for you? Yes or no? If it doesn't work, what can we do to change it? So yeah, it's come a long way, but hopefully it will only get better.